So holistic phenomena here. Again, same old, same old. Of course, we've got to do the anti-inflammatories. And I'm not going to go into details in the individual ones, of course. Of course, we want the oils in here to remind you any of these kind of polyps we'd get, or growths we'd get, or fibroids we'd get in the uterus and stuff like that. Usually the omega-3 oils are significantly involved. Pantothenic acid has also been shown to work on this. The B complex in general, B6 is also being used with that. MSM has been shown to be quite functional for anti-inflammatory in the mucous membranes in general, including the sinuses. So MSM is not just an arthritic phenomena, but arthritis is another type of inflammation. MSM can be used in this area. I don't usually use it. I'll give you my program later, but these are all things that can be used. I'm suggesting the most important thing is terrain again, and therefore we got to work with the diet. No dairy, no flour is typically the case. And I have some patients, so if they just have a spring allergy, I have to, so which would be, let's say, May, I start treating them in March. And so if I get a person to do a detox in March and have no dairy, flour, and sweets until, let's say, the beginning of June, they're good to go for another year lots of times. So it can be a seasonal issue. But there's no question a preemptive strike works best, and I'm suggesting 1.5 to 2 months ahead of time. As I pointed out, it'll often get to a point that it's not just that. Bitters for digestion can be a very big point, especially if there is reflux involved there. Carminatives, of course, with the whole digestion. Spleen restoratives can be useful for the overall area. Aperients can be useful to clean everything out. Digestive enzymes can be useful. And of course, avoid overeating, deep fried foods, French fries, potato chips, and stuff like that, because they would all affect the overall terrain to a degree. Tone up the respiratory tract, and we've got the various respiratory tonics and demulcents and vulneraries, and vitamin A and or beta-carotene. I typically in this situation use way more beta-carotene than vitamin A for several reasons we've talked about in the past, but our body will convert it into vitamin A if it needs it, and we can use the carotenoids for other things also. Vitamin C is very necessary in this. So and there are several other minerals and stuff like that, but the tocopherols are fairly important to vitamin E, but I really common give BEVC, which has the beta-carotene, it has the vitamin C, it has the echinacea for the immune bounce, and has the B6 that we're already talking about. So it works on the quality of mucous membrane. So BEVC, 1 to 2 of those twice daily is my most common one. Sometimes the flavonols will really slow down the growth of the polyps, so it can be useful there. Yes?
Quercetin, is that, I've heard of people taking that alone.
Quercetin, so quercetin will bind up immunoglobulin G really effectively, but this is immunoglobulin E and A typically. So quercetin is very good for food-bound allergies, and so if you have a food-bound allergy, let's say to dairy, and it's assisting this, then it would be useful. So the sinuses are usually A and G. Quercetin will work a little bit with that. On that same note, selenium will bind up the A and E. So lots of times we give selenium in these cases. But no question. So for food-bound allergies, immunoglobulin G issues, freeze-dried nettles and quercetin are some of the best. But of course, we're talking bioflavonoids in general, and quercetin is a bioflavonoid. So it could work in this area. But you've got the nuances of the difference. Immunomodulating herbs, again, top of our list is the reishi, but the astragalus and several of the other things that would be useful though. Parasympathetic herbs are in here, and TCM and Ayurvedic say you really want to remove whatever the obstruction is. As far as the minerals, zinc, magnesium, and calcium are very beneficial, and that's again where the BEVC comes in. It doesn't have the others, but it does have the zinc, and that really works on the surface. If I had to give you the number one best formula, I used to have a formula I used really a lot called Herbal, which is pretty good, but there's never been a formula I found better than Ping Ming Kang Wang. Ping Ming Kang Wang is the cat's pajamas when it comes to hay fever. You don't like Ping Ming Kang Wang?
That's the way you say it.
Obviously, I've said it a lot. Yeah, okay.
And the fact it's cat's pajamas.